If you are having sciatica symptoms, you are probably wondering what is causing it in the first place. Today, we are going to discuss the top 3 causes of sciatica symptoms, how to know which one could be affecting you, and what you can do about it. For many people, sciatic nerve symptoms come on suddenly. And what happens is that they have pain that maybe starts in their low back, definitely goes into their hip, may travel down the back of your leg and to the side of your calf or the back of your calf. And this pain, when it comes on, is often a sharp, shooty pain, and people feel like it just came out of nowhere. So if that sounds like you, then you're in the right place, because today we're going to help you determine what it is that's actually causing your sciatic nerve pain. The first one we're going to start with is the most common cause of sciatic nerve pain, and that's either a herniated or a ruptured disc. You see, the sciatic nerve is made up of the nerve roots of L4 to S2, and in between L4 and S1, so that's 2 of the lumbar vertebrae, there's a disc. In between L5 and S1, there's also a disc. That disc can either become herniated, which means it's putting pressure, it's bulging out a little bit, or it can completely rupture, which means the outside fabric of it has dissolved and you're getting discal material, so material that's supposed to be inside the disc is actually coming outside the disc. The reason why that is such a problem, other than the fact that your disc is no longer working completely normally, is that it puts an inflammatory exudate or an inflammatory soup that bathes that nerve. So that nerve can actually be irritated, not necessarily directly. When it's directly irritated, we call that a mechanical irritation, but it can be indirectly irritated by this inflammatory soup that it's now being bathed in. Because see, nerves aren't really smart. They just know that there's some kind of pressure or something that's irritating them. They send the message up to the brain and they say, hey, I'm irritated, and brain does what it does and tries to respond to that by sending help. Now that help is not always helpful, because one of the big things that will do is cause the muscles to contract. If your muscles in your low back contract and you have a herniated or a ruptured disc, that actually puts more pressure on the disc, which only makes the situation worse. So a lot of people have a sudden sharp onset of pain, and it seems to actually get worse as things go along. And that's because the muscles are starting to tighten up. They're putting increased pressure on that disc, which is putting increased pressure on that nerve, which is making your sciatica symptoms increase. So what you want to be doing is doing some gentle motions to help relieve that tension. We got to be careful what motions we do, though, if the disc is affected, because we don't want to cause any abnormal motions that cause increased pressure on the disc. So I'm going to link a video here that shows you the exercises that I recommend people do when they have an acute disc. So really a hot, aggravated disc. You want to move as much as you can pain-free in this situation. However, that can be difficult because it can be hard to find a motion that is pain-free. So these are the exercises that I recommend for patients who have a really hot, flared-up disc and they don't know what to do or what motions are pain-free. The second most common cause of sciatica symptoms that are traveling down the back of your leg is actually spinal stenosis. Now, this one is a little bit different than the typical sciatica symptoms in that it usually affects people over the age of 50. It usually starts going down both legs at the same time, and it usually isn't a sharp onset. So it's not like all of a sudden you go to plug in the vacuum cleaner and you have this sharp onset of sudden pain. This is more gradual and tends to come on over time. And again, it tends to come down both legs. Why that happens is because spinal stenosis is actually putting increased pressure on the spinal cord. And so that's why you have symptoms that go down both sides as opposed to one side or the other. And it tends to start in the low back, go down into the glutes, go down and follow the sciatic nerve down into the hamstrings and calf over time if it's left untreated. Another sign of this is that you may have noticed that as you get a little bit older, you want to bend forward more. And most people tend to notice this when they go grocery shopping. So you may go grocery shopping and grab a cart and you're just used to doing that, but then you start to realize, I need that cart in order to be able to walk through the grocery store. Because a grocery store, it's a bit of a distance as you're going up and down the aisles. And you start to rely on the cart and realize that if you don't have the cart, you're not going to be able to make it through the grocery store because your symptoms are going to increase so much. People often tell me with spinal stenosis that as long as I sit down for 10 minutes, then all my symptoms go away, and then I can continue walking on. So I had one patient once who was suffering with this, and he went to the gardens up in Victoria, and he had to go walk from bench to bench. So basically he could enjoy the gardens. It just took him a while because he had to walk to the next bench and sit and enjoy the gardens, walk to the next bench and sit and enjoy the gardens. But that's how he was able to make it through. I understand that's not how you want to live your life, but that is a good idea if you are really struggling at this point in time. Another way that spinal stenosis is different than the other forms of sciatica is that it tends to get worse when you're walking or moving. So a lot of people who have a disc problem or even a piriformis problem tend to feel better with more movement. Spinal stenosis, when you're standing up, especially if you do stand up straight, are actually going to have increased symptoms when they're walking or when they're moving around, as opposed to the other two forms. So if you find yourself preferring to be sitting, and especially if your symptoms go away 100% when you're sitting, chances are good that you probably have a spinal stenosis, as opposed to the other forms of sciatica. And the last common cause of sciatica symptoms is piriformis syndrome, or where the sciatic nerve is getting irritated as it goes through the piriformis. You see, the piriformis goes from the sacrum, which is that heart-shaped bone at the base of your spine, and it travels out the side towards your hip. It's kind of a thin, strappy muscle, basically. What happens is that the sciatic nerve goes either underneath it, on top of it, or right through the middle of it. All of us are a little bit different, and so all of these are considered normal because generally it's about 33% of the population that has each one of them. But if you're one of the lucky ones who has a sciatic nerve going through the piriformis or underneath it, and that piriformis gets tight, then that puts increased mechanical pressure on the sciatic nerve. These people usually don't have low back pain, and they don't complain about any symptoms in their back. Usually their muscles in their back are not that tight. They usually have pretty good motion in their back, and they don't have too much problems in their back. They have hip problems or pelvic alignment problems. And often it's the pelvic alignment problems that cause the sciatic nerve tension in the first place because it causes increased stress to the piriformis. You see, the piriformis is a muscle, and when the pelvis gets malaligned, it's one of the ones that tries to help by becoming very tight. And when it becomes very tight and puts pressure on that sciatic nerve, it causes a sciatica type symptom. The challenge with this is that you can do some self-massage for the piriformis, you can do some stretches for the piriformis, and this will make your symptoms go away for a short period of time, but you really need to figure out what caused that piriformis tension in the first place in order to properly relieve that piriformis tension in the long term, which will then relieve your sciatica symptoms. So I'm going to link a video here that describes some things you can do if you have some pelvic malalignment issues, and also what you can do to check for that at home on your own, which will be really helpful if you believe that what you're suffering from is a piriformis syndrome. All right, there you go. So if you're suffering with a sudden onset of sciatica, chances are good that it's either A, a herniated disc, or B, piriformis syndrome. If it's a herniated disc, chances are good that you have low back pain, and you might even feel unstable when you're trying to walk or move around. If it's a piriformis syndrome, chances are good that your pain actually starts in your hip and then travels down the back of your leg. And you might have a pelvic malalignment issue that would be really helpful to address in order to relieve that piriformis tension. Now, if you have pain down both legs that gets relieved particularly when you're sitting, chances are good that you have a spinal stenosis. And there's still some things you can do about that. But that way you know what's causing your pain, so you know when you're doing your research what you should be looking out for. Okay, there it is. Now that you know the 3 most common causes of sciatica, which one do you think is affecting you? Drop a comment below and let us know which one sounds most like you. If this video was helpful, give it a thumbs up and don't forget to subscribe for more health tips.